Well, greetings and salutations, and welcome once again to the Newsman Weekly Podcast, episode number 55. Guys, I don't know whether you know this or not, but I'm sure you don't. You're both too young, but, when I see the double nickel, I'm reminded of when the speed limit on the interstate was reduced to 55 miles an hour back in 1974. There was an oil crisis in 73. OPEC shut off the taps. We didn't have enough domestic production. So one of the government's solutions is you don't get to drive as fast as you did on the interstate. You drive 55.
Wow. Nationwide?
Nationwide.
I did not. I am too young to remember this.
And it stayed that way until 1995.
No way.
Oh, yeah.
For 20 years,
you weren't driving it, but you were probably around then, Zach.
55.
Yeah. Now, keep in mind, I got my driver's license in 1977. Okay, so I remember getting my license and thinking I'm going to go out and drive fast like all young guys do, but not on the interstates, 55. And it's even less on state highways and things like that.
That's terrible.
The absolute worst. When I moved from Georgia to Ohio, okay, I was 11 or 12 years old at the time. Anyway, my dad wasn't completely out of the Navy yet. He hadn't come home from his last cruise. So my sister and I rode with my grandparents in their camper truck. Okay? Imagine from Albany, Georgia to Kimbolton, Ohio at 55 miles an hour with your grandparents.
It's like the Oregon Trail.
That's got to be 18 hours?
The nice and bad thing at the same time is we're in a camper.
Sure.
So we're not looking for motels.
Right.
It's wherever Grandpa wants to go off the road and take a break for the day or the night. And if you're not sleepy and he is, you're SOL and you go wait outside because you're not going to wake him up.
Just go roam the streets.
Anyway, I didn't know whether you knew that or not. When I saw 55, it jumped out at me.
Wasn't surprised that you said that in the 70s, but I had no idea that it was like that for 20 years.
Yep, it was absolutely horrible. Hey, thanks again to everybody for joining us today. We know there are many, many, many places you can go every day for news, information, and even some entertainment. We're grateful so many of you come to us every week, and we know we couldn't do this show without your support, so please, if you haven't done it already, please subscribe to the show and give it a great rating. If you have, please unsubscribe, resubscribe, and re-rate with an equally high rating or perhaps even higher if you didn't give it a good high rating the first time. That's it. Anyway, many thanks to local country singer Luke Watson for writing and singing Smoke and Drink, which is this Woebegone show's theme song. My thanks also to the great folks at Relax It's Just Coffee for sponsoring this show and for being a great partner to the Newsman Weekly. Every day just starts better with great coffee, and our friend Paul Kimmerling and his baristas at Relax simply have the best in town at 105 North Main Street in downtown Mansfield. As you may have guessed or heard, I am joined today by Zach Heiser, the show's executive producer, who is back looking tanned and yet exhausted from a week-long vacation over the 4th of July. Are you as worn out as you look, Heiser? And tell the truth, aren't you grateful to be back in the office today?
It's nice to see you too. And, you come back and you just... I'm gone a week, but nothing changes.
Yeah.
You just kind of started the day off with a little bitch session, and
that's what I do.
It's just nice to be back.
I call it analytics.
Right.
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 It's like sports.
That's very
NFL
modern
analytics, baseball analytics. Mm-hmm. I have journalism analytics.
No, vacation was awesome. Michigan is we just explored. We were up in Boyne City. We went up to Mackinac Island. We went over to Torch Lake. We went down to Silver Lake and did the sand dunes and stuff. And I have to say, Michigan has got to be a top 5 state in this great country of ours.
Yeah, top 5 in terms of vacation, but do they cheat in vacations like they do in football?
Well, the sports teams notwithstanding. Speed limits are 75. You talked about 55.
And you know what? There's nobody in Michigan doing 75. They're doing 90.
Yeah.
They don't have
around.
All gas, no brakes when it comes to Michigan drivers.
Was nice. It was nice traveling in that state.
Did you run into any double roundabouts? Because there are some on 23. I know up by Brayden, which we have family that lives up that way. people in Richland County that complain about a roundabout, you haven't lived until you hit a double roundabout.
Right.
Because if you get in the wrong lane on a double roundabout, I swear to God, it's like a mini cloverleaf. You're just driving around and around and around trying to get over.
Didn't see any double roundabouts. But yeah, no, and the roads up in northern Michigan, they're not great. But I mean, I appreciate I feel like the state is, I mean, it's obviously got so much coastline and natural beauty, but I mean, they've also got the cheapest cannabis in the country.
No.
They're 75. You want to gamble, you can get. It's very libertarian state, but done in kind of a, I don't know. It is kind of it's a gem of the Midwest and the eastern portion of the United States. And I mean, clearly when you're driving up there and you're exploring all these towns, like it's not overly corporatized either. You can go into these towns and there's still a lot of charm. And as I mentioned, all the coastline, it's great. It's a great state.
I fully expected halfway through that for you to bust out and begin singing "Hail to the Victors," as you apparently
listen,
completely surrendered your allegiance
to
that state up north.
I do hate the sports teams up there.
All right. Hey, also with us as usual is Hayden Gray, who's the show's official videographer for at least one more week. We'll see how this week goes. Good morning, Hayden. Any shocking news from over the weekend?
Not that I can think of. Spent a lot of time outside on Saturday. I mean, a lot of time outside in general, but I didn't really do anything that would shock or surprise or probably even fascinate you, Carl.
Well, I did see pictures of you outside doing some sort of yard project. And what are you doing?
I spent about 6.5 hours.
Again, what are you doing?
Right. Clearing out space behind my shed so no one's going to see it.
Right.
But it was just a bunch of overgrowth and grass clippings from over the years, and I need somewhere to put my trash can that's not right by the house. So
the whole key to that sentence was what? Nobody's going to see it.
I know. That was the hardest part to come to terms with. It is the love of the game.
And I did see that Katie, our coworker, said she would give you advice on what kind of flowers to plant.
And I went ahead and just put my trash can back there.
Planting that was probably the way to go. It doesn't look like it gets a lot of sun.
No.
Did you check out the Honda Indy 200 tunnel?
I did. After I watched the British Grand Prix from Silverstone, which was
Formula One, the real auto racing.
Yeah. Well, again, I mean, there's Formula One and then there's everything else. Yeah. But I appreciate the IndyCar race in Mid-Ohio. I think from what I could see on TV, if it wasn't a record crowd, it had to be close. I mean, Mid-Ohio never announces ticket sales. But when you look, part of that reason is, there's no assigned seats. Well, there's some in the grandstand or whatever, but most people just find their own spot and set up chairs. And very good race. Was it Alex Palou? Should have won the race, was leading on most every lap. And then 5 laps from the finish, kind of had a brain cramp and went wide on one of the turns. Ended up, not sliding, but having to slow down, which allowed Scott Dixon from New Zealand, a.k.a. Mr. Mid-Ohio.
Mr. Mid-Ohio. How many times has he won?
That's number 7.
Wow.
Number 7.
At Mid-Ohio.
Yes,
he loves this track.
Yeah, Scott is a lovely man. I interviewed him years ago out there, probably 3 or 4 Mid-Ohio victories ago. But, that was definitely Palou's race to win, and he simply punted it away at the end. So
exciting.
Yeah, it was a good race. Hey, just as a reminder, folks, since Hayden is here, I do want to give him a little bit of credit for something. We post audio of this show every week, thanks to Mr. Heiser, but you can also watch it on the Richland Source YouTube page. So if you want to see behind the scenes of this multimedia madness, please check it out there, and we do have the link to that YouTube video posted every week when we do a story about this show on Richland Source. Hey, folks, we got another great show for you today. In a few minutes, we'll be joined by Brice Eyerly, the new executive director of the Community Health Access Project in Mansfield. In his role, he helps to lead efforts to improve health outcomes for vulnerable populations through coordinated community-based health care. So stay tuned for that conversation. We'll learn more about Brice and what's new with CHAP these days. But before then, we got some news for you. We are less than 2 weeks away from the monster music show of the summer. Inkcarceration at the historic Ohio State Reformatory launches its 3-day run on Friday, July 18th. I confess to not knowing a great deal about the musical genre loved by the 75,000 people that will fill the old prison grounds July 18 through 20. And that's 25,000 a day. It's not 75,000 at one time because there simply wouldn't be room for that. But I do love the fact Mansfield has become the home of one of the biggest rock music festivals in the Midwest. And I did see over the weekend, Ozzy Osbourne and Black Sabbath had their final show.
I saw that too.
And Slipknot, who will be playing at Ink, performed as one of the shows on the undercard before Ozzy and the boys came out. And I saw a video where one of the members of Slipknot, in front of Sharon and Ozzy Osbourne, popped the question to the Prince of Darkness's daughter, despite the fact Ozzy, before he did, dropped the F-bomb and said, "You're not marrying my daughter." And she accepted. So when you go see Slipknot at Inkcarceration, know that you're seeing Ozzy Osbourne's future son-in-law.
Interesting.
In the band. But hey, you guys are going to be out there covering it, so give me 2 or 3 bands or events or things you're most looking forward to seeing or hearing at Inkcarceration 2025.
I'll let you open it up, Zach.
Well, we were looking at bands to interview, and of course, at the top of the list is Marilyn Manson, the Ohio native. And I was looking at Marilyn Manson kind of tea over the years. I was like, he's pretty nice to journalists. He said this in 2009. In response to media scrutiny, Manson reportedly threatened music journalists in a since-deleted blog post. He said, quote, I am far different than the soon-to-be murdered-in-their-home press has decided to fabricate, he wrote, according to The Guardian. Quote, if one more journalist makes a cavalier statement about me and my band, I will personally, or with my fans, help, greet them at their home, and discover just how much they believe in their freedom of speech.
Well,
I sent that to Hayden. I was like, you got the interview for Marilyn.
I passed on that.
Yeah, for those wondering, that his real name is Brian Hugh Warner, and he's 56, and he's from Canton, Ohio.
Yep.
So, yeah.
Yeah, I mean, we've got the list of bands. We're just kind of, I think Brittany sent out an email, like just trying to cast a wide net and see who we get. So we'll see. I'm excited I am going to be helping do some coverage, so I actually have to think about a story angle. I wrote down a few things. I kind of want to cover more of the camping side and after parties and different things that go on at the campgrounds, which, could be a little bit more than PG rated. I'm not sure.
I think you should do a first person about the massive tattoo that you're going to get. Because it is the Inkcarceration Music and Tattoo Festival, right?
Yeah.
So I think you should
Richland Source tattoo.
No, get a Marilyn Manson tattoo so that way when you interview him, maybe he won't kill you.
I don't know. I'm not that bold.
Hayden?
I mean, last year was my first year covering it, and even and going to it in any way. I mean, just like you, I'm not super familiar with every aspect or part of the genre or bands that are playing, but I did see that they were already starting to, one of the parking lots to the side of the prison, they were already starting to cut down the grass and bale it so that people could get parking there in a couple weeks. I saw that yesterday.
Well, I did see one of the bigger name bands that's coming is Lamb of God.
Mm-hmm.
And I have a personal horror story about Lamb of God.
Tell us.
I was chaperoning the Lexington High School Band of Gold band camp. I think it was my youngest son's junior year in high school, so this would have been maybe like 2008, 2009, somewhere in there. And it's a week away. I mean, it's a week-long camp, so I'm responsible for chaperoning the underclassmen boys' dorm.
Already sounds terrible.
Yep. And they had massive speakers set up, and they had some Lamb of God song, and they had it on a loop. So every time they came in there, they cranked this thing up, and it just played the same song over and over and over again.
It's like in our office when you put on CCR.
Yeah, well, I just heard that when I came in
Jimmy
there.
The same four songs?
Yeah. No, I mean, it was just,
So you could come this year and write some kind of column of coming back to that music.
No,
okay.
That wouldn't happen.
Okay.
Earplugs are usually
A necessity.
a nice thing to
I learned
have.
that.
I'm excited about the media backstage and the media tent, and we
love
get
that.
treated pretty nice back there. It's
Right.
a little bit different than the dusty general admission grounds.
Because I can't stand crowds, but we are privileged enough to have access to places where you don't have to get in the middle of those.
Oh
And
yeah,
can
you
just-
don't want to be out there with the great unwashed. Yeah, oh yeah. I think the only rock concert I ever used earplugs was a Kiss concert in Toledo. God, back in the 80s. And
Yeah.
it was very loud.
Yeah.
So, we had a couple of big college football announcements over the weekend. 2 seniors to be this fall made their decisions known. Shelby quarterback Brayden Devito announced Sunday afternoon that he's going to play at the United States Air Force Academy when he's done playing for the Whippets. Lexington tight end Brayden Fogle announced on Friday that he will go and play for the University of Georgia after his senior year for the Minutemen. 2 of the best players in Richland County who will play against each other one final time, I believe on August 29th in week 2. So
That's a big game.
Guys, thoughts on those 2 big announcements?
Go ahead, Hayden. You covered DeVito extensively.
Yeah, I mean, I was excited to see. We've been talking about it for a little bit here internally in the office, just when some of these guys make their decisions, whether they like to make that before they start their senior year or not. But I was really interested to see where Brayden Fogle would pick. I knew that he had it narrowed down to those 3 schools, and I know Kurt, our sports reporter, has kind of mentioned that the SEC likes to come north to find their tight ends, that they don't really have that much, I guess, out of their high schools producing them down there. So seems like that'll probably be a good fit for someone like Brayden. I mean, Georgia has produced some pretty good tight ends here in the last few years. You've got Darnell Washington, you've got Brock Bowers. So the production's obviously there. And then with DeVito, I really thought, honestly, any school that he was going to choose would just be a great opportunity for him to get another chance to continue it. But good for him for the choice he made too, because that's a big commitment as far as outside of football as well. So excited to see both of them.
I know in the case of Brayden DeVito, he Air Force runs like most service academies. They don't run the same kind of offense that a lot of D1 colleges run, simply because when you have 240 and 250-pound offensive linemen, you're not going to run
drop back,
power run
right.
offense. So Air Force, traditionally going back to the days of Fisher to Berry, I think, started this. They ran a triple option offense. Now they've kind of modified that over the years, but it sounds like one of the reasons Brayden went there is because Air Force is going to give him the opportunity to play quarterback. And a lot of the other colleges might have seen him as a receiver or a defensive back, and the kid can throw the football, and he can run the football,
and he can pitch the football.
Yeah, and
so that's important, and run laterally, which is important in that offense.
And this is a great opportunity, and I hope he gets every chance to succeed for the Falcons. And so that's what I know about that. Hey, finally, the Richland County Land Bank has voted to sell the site of the former Ocie Hill Neighborhood Center to a developer who plans an affordable housing apartment complex for seniors. We've talked about this potential sale for a few weeks now, including last week when we had Richland County Commissioner Tony Vero, who's also a Land Bank member, on the show. The buyer is a company called Volker, which is a Wisconsin-based developer who is planning to pay $300,000 for the land at 445 and 455 Bowman Street. Assuming the company gets the tax credits from the state that it's going to be seeking, it plans to build an independent senior housing complex with units available to folks 55 and older. And you know what? That's me. I'm 55 and older.
Looking
and
for
there's plenty of senior housing.
Yeah, I can.
I'm getting confused and lost at what senior housing place is going where. So isn't there like 3?
Well, there's definitely one. There's one under construction right now, and I'm trying to remember the name of the street.
Klein.
Yeah, Klein Avenue. That's being built right now.
Yeah.
That's going to have some percentage of quote unquote affordable housing. But it's a $20 million plus.
Oh, so that's not
investment.
Just for seniors.
No, it is for seniors, but there's only, I think, a percentage of them has to be, a percentage of the rooms or apartments have to be made available to affordable housing.
Okay.
The others will pay market rate. This one is probably $15 to $20 million, I think, is the number in terms of the building investment that Tony tossed around last week. So it's a lot of money being spent to build housing for seniors. And as a senior, at this point I'm 64.
You've got options.
I'd like to have options.
you
I
do.
mean, my house is paid for, but
Yeah.
if my wife throws me out on my ear,
Sure.
I'd like to have an affordable place to go live. Yeah. Anyway, that's enough for now. Let's take a quick break, and when we come back, we'll be joined by Brice Eyerly, Executive Director of the Community Health Access Project. So stay with us. Well, welcome back to the Newsman Weekly. Joining us now, as promised, is Brice Eyerly, Executive Director of the Community Health Access Project based here in Mansfield. Good morning, Brice. Thanks for joining us, and thanks for getting up so damn early.
Thanks for having me.
Well, let's start by learning more about you. You're relatively new to your current role with CHAP, but you're certainly not new to North Central Ohio. So give us a quick biographical look at yourself. Where'd you grow up? Where'd you go to high school? Where'd you go to college? And how did you end up working at the Community Health Access Project?
Absolutely. So I'm a lifelong Richland County resident, lived here my entire life. I am an Ontario graduate.
What year?
2007.
Hey, I was
2007.
2007 at Lexington.
Awesome.
2007. I was
Great year.
36. So, yeah. Okay, thanks.
I was 9.
Wow.
Okay.
Okay. We're
Carry
done.
on.
Who invited this guy?
So we've established that 2007 was a good year for some and an aging year for others. But anyway, Ontario High
Absolutely.
School, 2007. What happened next, Brice?
Yeah, so I then went on to college at The Ohio State University, but I'll share the with you.
Thank you. As a graduate of The Ohio University, which was here in Ohio long before the Farmer College in Columbus came along, and I appreciate, and it's well noted, and you're very gracious to give me the word "the" today.
So I attended The Ohio State University here in Mansfield, graduated with a degree in English, and honestly, I wasn't sure what I was going to do. I thought maybe I wanted to be a teacher, but decided to go the healthcare route and went and got my master's through Mount Vernon, Nazarene University in business with a focus in human resources. While I was there, I transitioned to a role over at Worcester Community Hospital as the manager of patient access in their leadership department. And I was there for about 5 years.
What does a manager of patient access? What is that job?
Sure. So it's very much so focused on the frontline staff that people see when they walk into the hospital. So you go into the hospital, most of the time it's not for anything fun, but you have to greet that first line staff to give your information and make sure that we have the right person on the table. So my role was to oversee that across the entire hospital system.
Okay, because when you first said patient access, I had a access job once, but it was a doorman. So I was letting people in and out the door, giving them access to the
Absolutely.
To the building,
So I left my role there to move into a director of operations role at 3rd Street here in town.
3rd Street, it was the whole title. 3rd Street.
3rd Street Family Health Services.
Yes, I was trying to make sure I didn't butcher it, but yeah, 3rd Street Family Health Services.
And my role there was to oversee the day-to-day operations of every site. At the time, 11 sites across 3 counties and about 150 staff, 100 to 150 staff, depending on what time frame. I took some time off after that, and the role at CHAP opened up. I've always been a huge proponent of community health. Especially in the community I live in. I myself am a patient of 3rd Street Family Health Services. My 3-year-old daughter, the midwife at 3rd Street delivered my daughter.
Cool.
So that these resources that we have are abundant, but folks just don't necessarily know about them. So I'm always a huge proponent of utilizing the resources that we have for the folks that need them the most. So I stepped into this role in April. And getting my feet under me and starting to really focus on getting our name back out there.
It's interesting when you graduated from Ontario. I just want to go back and talk about one thing real quick. And you decided to become an English major. What was fun about that, and at what point did you decide This teaching thing might not be for me. And understand, part of the reason I ask this is Hayden, sitting over here, Hayden was going to be a teacher.
Pretty much same path.
He decided in his life to go a different route and find a job that paid less than teachers. So I'm hoping perhaps
no summers off either.
Yeah, exactly. Right. So I think you probably made a wiser choice by going healthcare.
Well, I don't know if I'll tell you what, I went nonprofit. And historically, statistically, nonprofit isn't all that much higher than teachers if we're looking at salary ranges. But I'll tell you where it changed for me really was when I started student teaching. I realized that it wasn't necessarily for me, and it's such a service. It's such a different service-driven role that I decided. Maybe another route. I can find another route to help people.
Yeah, Hayden, what was your experience like when you were just devaluing or leaving the education industry to pursue a journalism career?
Well, I mean, I can agree with something that Brice said. I think I saw signs of it once I was actually student teaching. Maybe I didn't pay as much attention to those signs as I should have earlier on because, I went as far to interview for a position. I think that was over at Lexington Middle School. And when I got in the car after that is when I was like, okay, yeah, I don't think this is it.
You people pleased for long enough.
Yeah.
Sure.
You had to.
But like Brice said, maybe I have found a different way to serve people too. Maybe not as good as Brice, but
it's interesting when it comes to student teachers. One of my biggest claims to shame has been the 6th grade. I made a student teacher cry because I was not.
You would make me cry.
I was the class clown, and I decided that my job was to. I think her name was Miss Valanga. I think my job was to disrupt her abilities to teach the class. And she finally had enough one day, and I think she broke.
Not much has changed with you.
So she probably got into politics or something less stressful. But all right, now, Brice, I was old enough that I was working at the Mansfield News-Journal when Doctors Sarah and Mark Redding launched CHAP 26 years ago, back in 1999. At that time, they were based out of the former Ocie Hill Neighborhood Center. What was the original goal for CHAP, and how has it continued to grow and expand?
Sure. So really, to understand CHAP, you have to understand the Reddings, and you have to understand the history of where the Reddings got the idea. So the Reddings went and spent some time in Alaska, and what they saw there was a single community health worker, which is a trusted individual in the community, working with an entire family within a household. And that may seem today standard, but at the time it was novel. Typically, you'd have an individual community health worker for each person in the house. But what was happening is that by doing that, you weren't addressing what we now call social determinants of health in that household. So Doctors Redding came back into Mansfield, and what they did was they sat down and they, with the help of Richland Public Health, as well as some other partner agencies, started actually map census tracking the various tracts around town. And what they found was that in census tract 6 and 7, which are going to be on the north end, that we had a 24% higher chance of an abnormal or poor birth outcome.
A lot of low birth weight.
Yes,
if I remember it correctly.
And then they compared that to some of the wealthier tracts within Richland County that had less than 3%. So what they did, as you said, was they set up shop right smack dab in the middle, right there at the Ocie Hill building. From there, from 99 until the mid 2000s, they would employ community health workers who went out into the community with a focus on working with moms who are pregnant to improve overall birth outcomes. That then transitioned in the middle to late.
Let's before we do the transition, let's talk about that for just a minute. When a community health worker went to speak with an expectant mother, what sorts of things, what sorts of advice or value do they bring to that mother?
Absolutely. So back in the day, it was very much so focused on just that prenatal care. But what happened was that in those early days, they had a community health worker who was working with a mother who was experiencing homelessness. But the focus was so much on prenatal care that they kind of let the homelessness fall to the side.
Mm-hmm.
The community health worker, out of her own will, helped them get housing. And then that mother hit every one of her appointments. Dr. Redding looked at that and he saw, well, we need to start addressing more than just the health outcomes. We need to address social outcomes.
Right.
So what they did in those early days was they focused on a very small subsection of risk factors. Making sure they hit their appointments for their prenatal appointments, making sure they have a family doctor, making sure they have transportation to and from. And what happened was that evolved into what our CHWs do now, which is essentially 21 different pathways. A pathway is simply a checklist, and that checklist looks at a risk factor. So, for example, transportation, and lack of transportation, and it gives a guideline for how to mitigate that risk and how to help resolve that for the participant.
It's tough for a mother to keep her appointment if she has no way to get to the doctor's
Exactly.
office or the hospital or wherever it is she's going, or 3rd Street,
Right.
wherever it is she's going. Well, what other, we said there's 21, what are some of the other pathways that a community health worker is looking at when they go out and do these visits and kind of, I assume that a family would get like in a dream scenario, you would have the same community health worker through the entire process.
Absolutely. Yep. So when a participant enrolls with CHAP, they are assigned a community health worker based on that initial need. Now, that can change if, say, the participant wants to change their health worker. But realistically, we look at what the needs of the participant are and what the skill set of the CHW are, and we match them with what we believe to be the most appropriate CHW. Now, some of the pathways, like I said already, are going to be things like access to transportation, access to housing, access to food security. We think about social services. So we work a lot with like local diaper banks, local food pantries, because buying diapers is expensive, buying wipes is expensive, getting a stroller, getting a car seat. Those are all social services. Finding a medical home, maintaining appointments, going to the dentist. These are all things that make up those social determinants of health that if we as a community help improve, we get healthier as a county and as a community.
Now, I know the Reddings, I think back in 2001, launched something that's now been adopted across the nation. It's known as the Pathways Community Hub Model. Explain to folks what that model is and why does it work so well in this area?
Absolutely. So CHAP, the Community Health Access Project, is the legacy hub. So the Reddings formed CHAP, and then CHAP kind of exploded across the state. The Pathways Community Hub Institute started, I believe, in 2015, and the idea behind it is that when you look at a hub like CHAP, you think very, very similar to air traffic control. So CHAP doesn't employ community health workers. CHAP is an organization that helps do quite a few things. We connect community health workers with the folks that need help. We train community health workers and make sure that they get trained through the Ohio Board of Nursing to become certified. We guide what the community health workers in the area do in terms of, how we take care of the folks and how we finish and monitor pathways. And because the role is outcome-based, we have contracts with all major managed care plans. So these organizations that we partner with, like 3rd Street, like Ruby's, like Independent Living, they get paid per outcome based, per units per outcome based. So if they close a pathway, they then get reimbursed so that money goes back into the community to help the people that need it.
Now, how is your organization funded then?
Great question. We are funded through 3 different sources. We are grant funded through the Ohio Commission on Minority Health. We also receive grant funding from United Way. We receive reimbursement from all the major managed care plans that we distribute out to our partner agencies, but also we do keep a percentage for the organization to operate. And then, finally, OCMH, United Way, and managed care organizations.
Now, how big, if you go back to when the Reddings started this and they found, I think the number you gave was 24% had issues with difficult births, well, especially low birth weight. How has that changed in those 2 census tracts in the last 25 years or so?
So what we found was there was a study done by Buckeye as well as another study done in Cleveland that showed that when a participant works with a community health worker from trimester 1 and 2 up until the birth of their baby, they saw a 50% reduction in overall low birth outcomes. So we can very safely say that if somebody works with a community health worker, they have a much, much higher chance of having a healthy birth weight, healthy outcome. And I can tell you in 2024, we had 113 births attributed to our participants, and we had 87% healthy birth weights.
All right. Go ahead.
I was going to say, I saw in 2024 you guys did a community baby shower.
Yep.
I was looking on your website, which is awesome because in Richland Source did a solutions journalism series back in 2017 called Healing Hope, and Brittany Schock led that, and we threw a community baby shower at this building at IdeaWorks at the time, co-working space, and had a lot of vendors come in. So it's how long have you guys been doing that? Was that your first one, or have you guys been doing that for a while? And do you plan to? Is that an annual event?
Yes. Yeah,
okay.
Great question. I wrote it down because I wanted to make sure I mentioned it.
Sure.
So we're in the planning phases of this year's event. I do have a date. It's October the 16th.
Okay.
It's going to be at Mid-Ohio Conference Center. And this is our 5th or 6th year. We started in kind of the midst of COVID, and we did it as a drive-through baby shower. Now we have the ability to be in person.
Right.
So we had our first planning meeting last week. We partner with Richland County Youth and Family, as well as quite a few other local agencies, and this is going to be our biggest year yet.
Yeah, and that's just free to expecting parents and
it's free
parents
to
with
anybody.
Babies up to 3 months.
It's
free to anybody. If I've
Anybody
got
that comes in.
10-year-old, I can come in and check it out. And okay.
So one of the great things about CHAP is that we turn no one away. So for the community baby shower, for services, nobody gets turned away. And our United Way funding, if somebody comes in and doesn't have insurance, that's what we use our United Way monies for, to cover those folks who may not be able to pay for services or may not have those insurances to pay.
So if I just want to talk through the beginning of a case, if let's assume the phone rings one day and you've got an expectant mother on the phone, 19, 20 years old, and she requests assistance.
Sure.
Talk us through how that process works.
Absolutely.
What should she expect to hear and see?
Yeah. So if an expectant mother calls in, the first thing that we're going to do is ask her if she's comfortable with somebody coming to meet with her. So kind of the crux of a community health worker is we meet you where you are. Now, that doesn't mean we have to come into your home. We can meet you at Starbucks. We can meet at McDonald's. That was kind of the beauty of the way that the Redding set this up is we'll come to you. We'll come to you in the community. So we'll ask, are you comfortable with a community health worker coming to you? We'll ask just some basic demographic questions, and then just kind of have a conversation over the phone. What do you need? What can we help with? From there, we will assign a community health worker to that participant, and that community health worker will then reach out and set up a time to meet with them. Once the community health worker goes to meet with the participant, it is a conversation just like we're having.
Right.
We don't have a list of standard questions. We don't poke and prod. It's very much so a conversation. So, hey, what's going on? What can I help you with? Well, we find out through that conversation that, mom is, 7 weeks pregnant, doesn't have a doctor. Well, why don't you have a doctor? And we find out why they don't have a doctor. Well, I don't have transportation. We use that conversation to then determine what pathways we're going to open. It's all about having that kind of interview style, very non-formal conversation with the participant. And then we, identify, say we have 3 or 4 pathways that we open, which ones are the most important and which ones are the most important to the participant. That's key, is what's most important to the person that we're working with. So, for example, if, say, we meet with a participant and they smoke, that might be really important to me that we work with them to stop their smoking. But if they don't want to stop smoking, it's kind of a moot point. So we want to make sure it's something we'll talk about, but we want to focus on the pathways that they want help with. And then we can work through those other pathways if the time comes.
All right. Talk about a little bit more about the organization itself. How many employees do you have at CHAP? Where are you based now? Tell us a little bit more about the organization.
Sure. So right now we're based out of the Marion 1 building over at 5 Points. And we have 4 staff, 5 with myself. We have an enrollment specialist, we have a program specialist, we have a couple billers. And we also do some other programming and supplies for pregnant mothers. Pretty small outfit, but small but mighty.
Yeah.
So we definitely wear a lot of hats, and we do a lot of things, many job duties in the office.
So sorry, go ahead.
Well, I was just going to ask real quick, since you just told us where you're located. For people, I would assume that they can kind of find out more information online, but for people that might not have internet access or ways to do that, would coming to your office be the best way for them to find resources?
Yeah, so we're there Monday through Friday, 8 to 5. You can absolutely come into the office. Our website is chap-ohio.com, and then our phone number is 419-526-CHAP 2427.
Now, when you assign a community health worker, where does that community health worker come from? Who are they working for?
Sure. So our partner agencies, we have 11 right now, and those community health workers come from, I'm going to try and name them all for you, 3rd Street, Independent Living, Ruby's, Project One, Goodwill, Knox Public Health. I know I'm missing some.
While you're thinking about that, when you mentioned Knox Public Health, that triggered in my head something we haven't talked about, that CHAP is active in how many different counties now in north central Ohio?
Yeah, we're in Richland, Ashland, Crawford, Morrow, Huron, and Knox County.
Are you doing all of that based out of the Marion 1 building, or do you have other offices in those counties?
We're all based out of the Marion 1 building, but we have partner agencies in those other communities, and we're looking to continue to expand. Not necessarily expand into other communities or into other counties, but expand in the communities that we're in. So if you look at Ohio, so going back to the history of CHAP, right? So CHAP started this entire movement. Right now, there are hubs that cover 72 of the 88 counties in Ohio. So it has not only grown in just those counties, but it's also grown across 19 states in the United States. So it's scalable. So what Drs. Mark and Sarah Redding did was they created the Pathways Institute because it was scaling so much that we started adding hubs that covered different counties.
Now, I do see when I look at your website, and again, it's chap-ohio.com, there is an easy form. If somebody has a question, it does have your phone number, but there's also an easy form that they can fill out online and submit. And I do see you've got my friend Linda Bender
Yes.
working in your office. And God bless Linda. She's been around for a long time, and I'm sure she's doing a great job for you guys.
Absolutely. She wanted me to say hello, actually.
Okay, well, good. Yeah, our sons played travel baseball together many, many years ago. Toby was a great pitcher and catcher from Madison, and he was a lot of fun to be around, and we spent a lot of time together with the Bender family. But well, let's talk a little bit. One of the things I also saw on your website, not only can people connect and contact and learn more about your organization, but they can also donate. Talk a little bit about, explain what your needs are and how people can help with that.
Sure. I mean, we're always accepting donations. We are, a nonprofit. Any donations that come through, typically, we receive a lot of donations from local churches or pantries. And really, those donations, what we take the most of is going to be things for babies, and then we take those and we give them right back to the participants. So, a CHW in this community has what we would call a toolbox, a metaphorical toolbox. They can say, hey, this person needs a car seat. They know where to go for the car seat, and I'm sure you've heard this, but Richland County is relatively resource rich. People want to help other people in this county, but a lot of folks don't know how to find those resources. So we try very hard to make sure that our CHWs know, hey, if a mom needs this, she's going here. If a participant needs this, let's go here. But sometimes you just can't find what you're looking for. So we try to keep a stockpile of things that we can, if for example, we can't find those resources, we have them on hand. Car seats, booster seats, pull-ups, things like that we have in case we can't find those resources. And I'll tell you, a lot of times we receive things from our friends over at Wayfinders. If they get donations of baby items, they'll send them our way so that we can distribute them.
Well, I think it is cool when I clicked on, you have a CHAP's mom and baby wish list, which connects to an Amazon site. And if folks want to go and look at that, there's all kinds of cool things you can buy for babies. And those, I'm assuming if somebody buys anything on this list, it gets delivered to you guys.
Correct.
For usage there. It's been a while since been buying things in the baby business, but. All right, so what's we'll get ready to wrap up. But what's next? What's the next story for CHAP? Where are you guys going now?
Yeah, that's a great question. So one of my goals as a new executive director is I want to make CHAP as visible in the community as possible. So I want folks, especially people who may need help, to know that we're here. One of the questions that I was asked very specifically by my board is, how are we going to make ourselves visible? We are doing all these great things, but it feels like we're kind of behind the scenes. So let's get our name out there. Let's talk about all these things that we're doing for people so that folks in the area know that they have somewhere to go. They have somebody to talk to, and we can get them set up with the tools they need to succeed. So that's really important. The other piece that we're really focusing on, like I said just a little bit ago, is that expansion into the communities that we're serving. So, I'm working with some agencies in Huron, some agencies in Knox to hopefully kind of expand out our reach. And then finally, we want to make sure that we're adhering to our roots. And our roots are taking care of prenatal moms, taking care of moms when they're pregnant. So making sure that we're adhering to that kind of idea that, we'll take care of everybody. Like I said, we turn no one away. But our focus from the beginning has been on taking care of mom and making sure that we have those healthy birth outcomes when mom delivers.
All right. Well, folks, we're going to wrap up today's show on that note. Many thanks to Brice Eyerly from the Community Health Access Project for joining us today. Thanks for coming in. And
thank you.
Hopefully we've taken a step in one of your goals in terms of informing the public that you're out there. Mm-hmm. But for now, thanks again to all of you for listening to the Newsman Weekly. I'll be back in a second to put a bow on this week's episode. But until then, remember what Mark Twain said. If you tell the truth, you don't have to remember anything.